Let's go to this thing about COVID-safe behaviours. What else can parents be doing to keep children safe?
Well, this is really critical, I think, and I think we can all see now, coming to the end of the third year of the pandemic, that a lot of people are just trying to walk away from COVID and pretend it doesn't exist. And sadly, the reality is quite different. It does exist, and in fact, we're in the middle of another wave. So it's really important that we do everything we can to reduce transmission of COVID in the community and to prevent adults and kids getting infected. So that's things like wearing a mask indoors in crowded places. Now, that is hard for children, young children. It's also hard for some children with disabilities, and it may not be possible. And we understand that. And as paediatricians, we're very sensitive to that. We know there are some kids that can't tolerate masks on their face. It makes them very distressed or anxious, and that's fine. But where possible, in very crowded places indoors, we're still recommending that, kids and adults wear a mask. I certainly wear a mask, when I come here into the hospital, when I catch the train, when I go into shops. So I think masks still have a role. And then, of course, those other really important, simple measures that we can take around hand washing, sneezing into our elbow, if we have some respiratory symptoms. And of course, there are many families that also choose and schools and other workplaces to try and do everything they can to improve ventilation and to have clean air. So whether that's just simply opening windows or whether it's actually getting some of those more fancy HEPA filters to try and clean the air. So I think it's a number of things, Kerry. It's really about hand washing and not sneezing into open air and sneezing on other people, using tissues. It's about using masks. It's about making sure that we ventilate the areas that we live and work in the best way we can, and just being really conscious, social distancing, about the fact that COVID's still very much in the community. Sadly, we have these new variants, and we need to be really conscious about not spreading COVID and trying doing everything we can to reduce COVID cases in the community.
And what about getting tested, Margie?
I think it's really important if people have symptoms that they test. RAT tests are still very, rapid antigen tests are still very freely available in pharmacies. We certainly have boxes of them at home. Schools, we're freely giving them out. I think we've got a whole cupboard of RAT tests. If people can't access them, then we would encourage them to go to the pharmacy or speak with their GP. But testing, RAT testing or PCR testing with symptoms, I think is still really important. Whilst there aren't strict recommendations anymore to isolate, it's still very clear that if you test positive and you have symptoms, that you should stay at home until you don't have symptoms, and then to wear a mask in indoor settings, in particular when you go out again into the community, and just be very conscious about, not spreading COVID.